Hello, everyone, and welcome to Henry Schein's continuing series on COVID-19 on YouTube. I'm Dr. Gary Severance with Henry Schein, and today we join Dr. David Reznik for his regular update, where he will cover the latest information, including the COVID variants in the United States, the status of state vaccinations, and recent ADA and CDC guidance, along with much more. But first, we'd like to congratulate Dr. Reznik as the 2021 recipient of the Dr. James Crawford Award from OSAP, the Organization for Safety, Asepsis, and Prevention. The Dr. James J. Crawford Award is named in honor of one of the founding fathers of dental infection control. Awardees have made major contributions in science, education, or public policy related to OSAP's core competencies of infection control and patient and provider safety. And you, Dr. Reznik, are certainly deserving. Congratulations from all of us, Dr. Reznik.
Thank you, Dr. Severance, for that remarkable introduction. I was very humbled by the receipt of that award. You just don't really think about things when you're just going through your natural daily life, and then I guess other people notice. So very grateful, and once again, thank you for that. So where are we with the pandemic? And I think that most of us realize at this point, outside of the dental setting, now I'm just talking about in our normal life, that we're sort of back to normal. At least a lot of us are showing that we're back to normal. I don't know about you, but I've been to a ball game now. I've been to a restaurant or two now. And the traffic in Atlanta is turning back to its normal self. So the Gallup survey is showing that 2/3 of U.S. adults say life is back to normal. And honestly, it does appear, again, outside of the dental setting, and I want to make that clear, that our lives are back to normal. And what will normal look like in our dental settings is sort of a little bit of a theme I'll try to talk to today, because we'll go over some of the OSHA guidelines that have recently come out. But due in large part to the mass vaccination efforts, which we all know have been going on, we had big vaccination efforts in Atlanta, at our hospital, at Grady, at the Mercedes-Benz Stadium. We're continuing at our hospital vaccinating people. Seeing most adults age 18 and older are fully vaccinated according to COVID-19. 2/3 of adults, 66%, say their lives are either somewhat or completely returned to normal. And that's remarkable when you think about where we were a year ago. We were nowhere near normal. We were trying to figure out how to get our practices started. We were trying to figure out how life was going to move on, what we're going to do with children as far as school goes. So really, there's been a great deal of progress. And I want to stay on that really, truly positive note. The percentage is an overwhelming reversal from last October's polling, which only found 9% of Americans at the time felt a sense of normalcy. So, wow, that is remarkably incredible. People are getting comfortable. But like I say, we're in summertime now, and it was expected that we would have a bit of a drop, and we're having a great drop. But Georgia just hit 900,000 cases of this disease. We have already lost 600,000 people to this disease. I work in HIV, and I've been working in HIV since the 80s. And we all know that HIV led to our bloodborne pathogen standards, et cetera, and we try everybody's if they have a bloodborne pathogen. Well, since the beginning of this disease, we have lost 700,000 people to HIV. That changed how we do our practice. There's 1.2 million people living with HIV out of our 350 million plus. It's changed how we do our practice. So I think our practice is still going to be changed to a degree. But again, let's stay on the positive note on how life has begun to return to normal. Many dental practices are returning business as usual, according to the ADA poll. 61% of dental practices are open with business as usual, according to the ADA, conducted the week of May 17th. 96% of adults are comfortable visiting the dentist right now or have already done so. My practice is back to full steam ahead. Patient volume in private practices was at 86% of pre-COVID levels nationally. So we're seeing that the private practice sector is rebounding. The public health sector is beginning to rebound. Life is beginning to go back to normal. In a large-scale study, which looked at national representative sample of U.S. dentists who responded to a monthly web-based study looking at COVID-19 testing received, symptoms experienced, infection prevention practices, etc., the cumulative prevalence rate during the 6-month study of dentists was 2.6%. We are much lower than almost every other kind of healthcare provider. Again, showing that the PPE that we wear, the extra equipment that we may have purchased, what we do is to provide the safest dental visit, and we continue to do that. I think we were ahead of our medical professionals outside of the OR because wearing a face shield, wearing a mask, wearing gloves, wearing a gown, those were things that we had been doing for decades. And then, like I've said before in other broadcasts, one of my best friends and colleagues, chief of ENT, didn't even used to wear a mask when he would look at his patients. Now, his infection control practices are more closer to what we do in the oral health center. A significantly greater rate of dentists are performing aerosol generating procedures recorded during this 6-month study at 98.4%. And when the 1-month survey was 92.8%. So people are doing aerosol generating procedures and still being able to remain safe. Remarkably important and remarkably successful. The proportion of dentists who have been tested for COVID-19 increased over time. It was a little bit over 16% on the initial survey. It was up to about 44% in the final survey. Again, more people are knowing their status, which is really important. Enhanced infection prevention and control strategies in the dental practice were reported by almost 100% of dentists each month. And that is very, very important. And we knew that there was a problem. We addressed the problem, and we've been successful. So congratulations to the field. We're doing a great job. The near universal adoption of our advanced or enhanced personal protective equipment, and I don't really know how different it was, with the exception that we started wearing N95 masks. And we maybe, in my case, we bought HEPA filters, we bought extra oral aerosol evacuation systems. The whole goal was to provide a very safe visit. And you can see that the near universal adoption of these programs had led to low cumulative prevalence in monthly incident rates amongst U.S. dentists. Strict adherence to enhanced infection control permits oral health care to be delivered safely. Again, this is so key. Don't stop what you're doing is really what I'd like to get across. Keep those visits safe, protect yourselves, protect your staff, protect your families. That's what we need to do. And if you haven't been vaccinated, let's move it. So what about breakthrough cases? We hear a little bit about that. We know that the CDC has sort of changed. They were looking at all breakthrough cases for a while, and now they're actually looking at breakthrough cases that end up in the hospital, or regretfully, those who have passed away from COVID-19. So they're really looking at specifically what is it with this patient population, who is getting infected, and why, and what are these breakthrough cases happening to a certain part of our population. More than 139 people in the U.S. have been fully vaccinated as of June 7th. Like with other vaccines, vaccine breakthrough will occur. It is not 100% effective. None of these vaccines are 100% effective, and that's very important to remember. Even though vaccines are working as expected, asymptomatic infections among vaccinated people will still occur. So it's something that we're going to see. There is some evidence that vaccination may make illness less severe for those who are vaccinated and still get sick. So there's advantages to being vaccinated even if you have a breakthrough infection. Current data suggests that COVID-19 vaccines authorized for use in the U.S. offer protection against most of the SARS coronavirus 2 variants currently circulating in the U.S. And we know there's a new variant here, and we're going to talk about that in a minute. However, variants will cause some vaccine breakthrough cases, and that's one of our concerns. There are about 248 counties in the United States where the vaccination rate is less than 25%. So you're basically having an area where there's very few people who are vaccinated who will get infected at some point. Maybe there'll be a certain level of natural immunity, but will this lead to more increased variants that become even more resistant? So that's something that we are watching closely. CDC is leading multiple vaccine effectiveness studies to ensure that COVID-19 vaccines are working as expected. So we are tracking this information. CDC is coordinating with state and local health departments to investigate COVID-19 infections amongst people who received the vaccine, called the vaccine breakthrough cases, and identify pattern and trends in one, patient characteristics such as age, and you'll see that people over 65 are still more at risk, or underlying medical conditions. And we've covered that before, that the vaccines aren't as effective for, say, people with blood cancers, or people who have transplants, or people who might have some rheumatoid arthritis or IBS or things of that sort. The specific vaccine they've received, is it breaking through on an mRNA vaccine? Is it breaking through on an adenovirus vaccine? So it's something we need to look at, and whether a specific SARS-CoV-2 variant caused the infections. So how do you define a vaccine breakthrough? So what they basically did was they looked at 2 weeks past the second dose. That's when you're supposed to be fully covered, is 2 weeks past your second dose, to see if there was any detection of SARS-CoV-2 RNA or antigen in respiratory specimens collected from a person, again, greater than 2 weeks out. As of May 21, CDC I mentioned transition from monitoring all reported vaccine breakthrough cases to identifying and investigating only the hospitalized cases. So what they really are doing is they're going to do a really good deep dive into why these folks are in the hospital and what is the impact there. So if you look at hospitalized or fatal COVID-19 breakthrough cases reported to CDC as of June 7th, there are some interesting cases that we've seen. We have 3,500 cases. Females are about half. People greater or equal to age 65 years accounted for 76% of these cases, so still vulnerable. Asymptomatic infections were 18%, hospitalizations 95%, and deaths 17%, or 603. Now, if you look at the hospitalizations, 24% reported asymptomatic infection and were hospitalized for other reasons than COVID-19. And if you look at deaths, 17% of the 603 fatal cases reported as asymptomatic and not related to COVID-19. So, for instance, at my hospital, you will see somebody who is transferred to our stroke center who's had a massive stroke, also ends up testing positive for COVID-19, but died of the stroke. And so that's things that they're looking at, what caused the stroke in the first place. So really a deep dive is what we're looking at. But bottom line, our vaccines are effective. Vaccine breakthrough cases occur only in a very, very small percentage of vaccinated people. There really have been no unexpected patterns identified in case demographics or vaccine demographics amongst people who reported to have these breakthrough infections. So bottom line, they're effective. CDC recommends that everyone 12 years of age or older get the vaccine as soon as it's available or as soon as they can. People who have been fully vaccinated can resume activities that they did prior to the pandemic. As I mentioned before, you can do your concerts that are going on outdoors. And part of it is during the summer, we're outside. And it's almost impossible to get this infection when you're outside in the airflow. So airflow, as we've discussed in dental offices, is also very important. So you can do things that we used to do. I had my first meeting with my entire team that had been double vaccinated, and we were in the same room. It wasn't a Zoom meeting. It was really somewhat fascinating to actually be in a room with people and not see them on a Zoom camera. But unvaccinated people remain vulnerable to COVID-19, especially some of these dangerous variants. Caldwell from CNN reported that more cities and states are lifting COVID-19 restrictions, New York, California, as overall infection and death rates decline. But officials continue to warn that those unvaccinated remain vulnerable to the virus, especially to these dangerous variants or variants of concern, which could set back our national progress. According to this article, 64% of adults have received at least one dose. and about 53% are fully vaccinated. And there are some who have natural immunity. We do need to talk about that. And the Biden administration's goal of getting 70% of adults with at least one dose by July 4th will fall short. But again, we do have things to celebrate this July 4th. We're back outside. We're seeing people. We're hugging family members. We can have that July 4th barbecue and invite people over. So it really is a significant change and a very positive one for us. More than a dozen states have hit the goal of 70% people getting vaccinated, and that's pretty darn special. So what's different about this Delta variant that we keep on hearing about? The variant that first showed up in India, and we know that India was ravaged by this because they had very low vaccination rates. And it is called a variant of concern. So there are some variants of interest, but when it becomes a variant of concern, it's something that we really need to watch more closely. These mutations were actually detected from two different strains. They're in one particular variant. So they could change the way the virus attaches to a cell, make an activation step easier, and block some, but not all, of the antibodies that do the most good. And this is from Texas A&M's Global Health Research Complex. It does appear that the Delta variant has mutations that are associated with increased transmissibility that we're seeing in other variants as well. And it does appear to be out-competing other versions. And so this version is more contagious. It eventually will become the predominant version like it did in the UK. And so that's something we need to look at here. There is not conclusive evidence, and this is also important, on whether it causes more severe illness. Back in the earlier talks, when we were talking about the UK variant, and I think that was the Alpha variant. When we talked about that variant, we talked about the possibility of it causing more severe illness. That did not pan out. It did not cause more severe illness, but it is more transmissible. This virus is more transmissible, and we don't believe that it causes more severe illness at the present time. The Delta variant only seems to be a real issue in people who are not vaccinated, and is another reason to get vaccinated. Those who've been fully vaccinated appear to have sufficient protection against this variant, so it's not breaking through our Pfizer or Moderna or J&J vaccines. This is likely, or the new vaccine that's just hitting the market. This is likely why the Delta variant became such a problem in India, as I've stated, because their vaccination rates were low, and the world is trying to help respond by offering vaccines to places that are in need. We really need to address this as a global issue, not just the United States, because as we know, this is a global economy, a global environment, and people can bring in the disease. So people who had previously had COVID-19 also appear to be similarly protected. So there is part of that natural immunity. People who previously had COVID-19, as I said, to be protected. A study from Public Health England found that 2 doses of Pfizer vaccine was 88% effective against symptomatic disease from the Delta variant, compared with 93% effectiveness against the Alpha variant. The biggest takeaway from the study, however, is that you really need the second dose for the highest level of protection, and that is really key here. Both AstraZeneca and Pfizer vaccines in the UK were only 33% effective against the Delta variant for people who only had 1 dose. So getting 1 dose doesn't get the trick. Get your 1 dose and then go back and get that second dose. That's the major lesson here. Will the Delta variant affect us worse as we head into fall? And I think that's a concern that we're all looking at. When climate gets cooler, in the fall, and we head indoors together, we will likely see more contagious variants spreading among unvaccinated people with low natural immunity. The easiest and safest way to eliminate this threat and future variants is to be vaccinated. So I know I'm staying on course. I know I'm repeating myself, but we're still only about halfway through of getting people completely vaccinated in this country, and we really need to move further along. According to Dr. Gottlieb, the COVID Delta variant appears to be more dangerous than earlier strains. However, the former FDA chief said he believes it's likely not a major threat in the U.S. until fall. So let's enjoy our time together. Let's encourage family people to get vaccinated. People who are fully vaccinated are pretty well protected against this new variant. So good news, we can protect ourselves. Let's change for a second and talk about what the EEOC has said. According to the Dental Hygiene Journal, Dimensions of Dental Hygiene by Christine Machado reported that according to a brief from the United States Equal Employment Opportunity Commission, or the EEOC, employers can require their employees to be vaccinated against COVID-19 as long as accommodations are made to comply with the Americans with Disabilities Act and Title VII of the Civil Rights Act. The EEOC also indicated that employers can provide employees with incentives to encourage to get them vaccinated. So you've heard about some of these state incentives. You've heard about some of the issues where a small percentage of nursing staff at a very large hospital refuse to get vaccinated and all that kind of stuff. So the EEOC can provide, and it depends on what kind of state you live in. We're at an at-will work state in Georgia, and many of our states are there. So it's really important to realize that this is the new case. What about the new OSHA emergency temporary standards? We've gotten some news from some of our contemporary associations. Dental practices are mostly exempt from OSHA's new emergency temporary standard to protect healthcare workers from COVID-19. Those most likely to be affected by the new standard includes hospitalized-based oral surgery practices or practices like mine where we're still located in a hospital who provide care for COVID-19 patients. So bottom line, I can't change what I'm doing. And I would say, how do we know who is a COVID-19 patient since 50% of the people who present with COVID are asymptomatic? And you don't know. The great news is that dentistry is largely exempt from the additional federal regulation, which, by the way, was 800 pages long. So I'll be honest, I did not read the entire 800 pages, but I did read the parts associated with dentistry. Because dentistry, why are we separated out? Because we've been doing infection control, protection, and safety during the pandemic and before. But what should we have? Dental office should have a written COVID-19 plan in place. So if OSHA visits, you best have a plan in place. If an office is covered under the emergency temporary standard, it is mandated. So we do have that at the hospital. If an office is exempt, private practices, it should still do a hazard assessment and written plan as recommended by OSHA's recommended practices for safety and health programs. Pre-appointment. So what are we supposed to do? Pre-appointment screenings are still necessary, and that's something that we should not stop. Everyone, and this is from OSHA, related to dentistry, everyone, patients, non-employees on site, and staff must be screened prior to entry, and those with suspected or confirmed COVID-19 are not permitted to enter. Dental practices must have a written COVID-19 plan. A state OSHA or other local regulatory body may enact a more stringent standard, including one that does cover dental offices. So again, it depends on your state, it depends on your OSHA recommendations, and that's really where we are at this point. But what else does it say? Personal protective equipment. We must provide and ensure employees use respirators and other PPE for exposure to people with suspected or confirmed COVID-19 during aerosol generating procedures on a person with suspected or confirmed COVID-19. As we all know, aerosolized generating procedures includes ultrasonic scalers, high-speed handpieces, air water syringe, air polishing, air abrasion, use of lasers, etc. Note that respirators, N95s, are not mentioned as required when treating patients who are not suspected or confirmed of COVID-19. Again, would stress the use of office hazard assessment in order to understand the level of risk. So this is sort of my concern. As I mentioned earlier, there are 1.2 million people in the United States with HIV. There are more people who have hepatitis, but we're all vaccinated in the dental industry against hepatitis B. We have a cure for hepatitis C. But we put in bloodborne pathogens because we assume that every patient who comes into our office at the present time has a bloodborne pathogen. Again, it's a relatively small percentage of the general population. 900,000 cases of COVID are in my state of Georgia. So, shouldn't we look at every patient who comes into the dental setting as someone who has an airborne pathogen? And that's my concern. How are we supposed to tell if someone has suspected COVID because 50% don't show up with a fever, 50% don't have shortness of breath, 50% don't lose sense of smell and taste. So again, I think for us to be safe, we really need to maintain some of those procedures that we put in place during the heart of this pandemic, because we don't want it to impact our patients, we don't want it to impact ourselves and our staff. We need to provide respirators and other PPE in accordance with the standard and transmission-based precautions, and allow voluntary use of respirators instead of face masks. So we have respirators. I am not allowing my staff to use anything but an N95 when they are performing aerosol generating procedures, period. I'm not going to take the risk that we're going to have somebody in the clinic who has COVID and got past our screening because we didn't detect a symptomatic spread. So again, we're using all of the tools that we purchased during the heart of this pandemic. We're making sure that we have our N95s on, our shields on, our extraoral evacuation systems, our high-speed volume evacuation for our dental hygienist, extraoral evacuation systems for our hygienists, the whole 9 yards. I don't want any of those people, and I don't want aerosol floating around in the clinic that could impact somebody else. So every step, including HEPA filtration, we are maintaining until this is completely over. Training. The employer must ensure that each employee receives training in a language and at a literacy level the employee understands, and so that the employee comprehends at least the following. How do you get COVID-19? What are the office policies on patient encounters, cleaning routines, etc.? What and when is the proper PPE to be worn? In my clinic, like I said, N95s, no choice. Employer-employee policies on all aspects, including but not limited to the use of common areas such as the employee break room. So again, we're trying to do as best as we can protect ourselves. Now, my entire staff, as I mentioned, is vaccinated. And so when we're in our break room, we don't sit next to each other, but we do try to protect one another. And that's part of what we do. We talk to our patients about getting vaccinated. Ventilation. Ensure that employee-owned and controlled HVAC systems are used in accordance with the manufacturer's instructions for use and the design specifications of the systems. Air filters are rated at minimum efficiency reporting value, MERV 13 or higher if the system allows it. The information is intended to help dental practices assess and mitigate, not eliminate, but mitigate the risk of coronavirus transmission during the current pandemic. Dental practices do not presume that following the recommendations will insulate them from liability. Dentists should also be aware that any relevant laws, regulations, or rules adopted by their state must take precedent, because your state rules overrule your federal rules. Now, a disclaimer. The materials are intended to provide helpful information to dentists and dental team members. They are in no way a substitute for actual professional advice based on your unique facts and circumstances. This content is not intended or offered or should be taken as legal or other professional advice. You should always consult with your own professional advisors, either your attorney, your accountant, your insurance carriers, etc. To the extent ADA has included links to any third-party website, the American Dental Association intends no endorsement of their content and implies that no affiliation with organizations that provide their content. Further, ADA makes no representation or warranties about the information provided on outside sites. So, stepping back now from EEOC and what OSHA is saying, what about these reports we're hearing from the CDC on higher number of expected cases of myocarditis or pericarditis in cases amongst young people who receive COVID-19 vaccines? Preliminary findings from 2 vaccine safety monitoring systems suggest a higher than expected number of cases of heart inflammation after the second dose, not the first, after the second dose of mRNA COVID-19 vaccines in young men. According to the CDC, over half of myocarditis or pericarditis cases reported to the U.S. Vaccine Adverse Event Reporting System, or VAERS, after patients had received the Pfizer, BioNTech, or Moderna vaccines were in people between the ages of 12 and 24, who made up and this age group made up less than 9% of all vaccines given. During a June 10th presentation to the FDA's advisory panel, the CDC said that it received 275 reported cases of myocarditis, which is heart muscle inflammation, or pericarditis, which is inflammation of the heart muscle lining, in people ages 16 to 24 after their second dose of Pfizer or Moderna's vaccine. The number of cases is higher than expected than the 10 to 102 cases of the condition scientists anticipated in that age group. So something is going on, and we're actually looking into it. The findings are preliminary, again, very important, and scientists are still working to determine whether there's a causal or causal relationship between the heart inflammation conditions and mRNA. So we're seeing this. We need to determine what the cause is, or is it just something that we're casually seeing? Is the mRNA vaccine causing something to happen in this age group or not? And it's still a very small percentage of those who have been vaccinated. But it did lead to an emergency meeting of the CDC, which is happening at the time of this broadcast, to determine what their plans are or should anything happen based on this. But if we look at hospitalization of adolescents aged 12 to 17 years with lab-confirmed COVID-19, we have data from 14 states from March 1, 2020 through April 24, 2021. We had 204 adolescents hospitalized that were assessed. Nearly 1/3 required ICU admission. 5% required mechanical ventilation. The good news is that no one died. So adolescents aged 12 to 17 are eligible to get this vaccine. And what does this vaccine do? It protects against severe illness, allows kids to safely join group activities. It's safe and it's free. And those are also very important issues. So what I'd like to end is we're seeing new regulations come out. We're relaxing our lives. Our lives are getting back to normal. And I think for our lives as dental healthcare professionals to maintain a sense of normality, keep up all the wonderful infection prevention tools and efforts that you've had in place during this pandemic. We have done a great job. We are not getting infected. Our hygiene staff is not getting infected. And one of the issues that we are having is getting people to come into the profession from the hygiene side and the dental assistant side. And if we can show that we are providing the safest dental visit for our patients, for our staffs, for our families, getting folks to return to work as dental assistants and dental hygienists will be easier. With that having been said, again, I'm grateful for the introduction that Dr. Severance gave. I'm grateful for people who have followed us during these COVID-19 webinars, and I look forward to seeing you next month. Thank you.
Thank you for the comprehensive update, Dr. Reznik. If you have any questions, concerns, or topics for future episodes, please email us at webinars@henryschein.com. And please subscribe to our Henry Schein YouTube channel by clicking the subscribe button below and click on the bell icon to be alerted to any new premieres. With that, we'll see you next month with another episode in this series. Until then, stay safe and stay informed.